Patients really want to know what exactly is going on when they come to the emergency department, and oftentimes we can only give them kind of a vague response of, you have a virus, or we think you have pneumonia, and not anything more specific than that. The Biofire testing really helps us be much more specific in our diagnosis. We're able to tell them, exactly which virus or which bacteria they have. They trust that, okay, if we have that result, we're probably able to treat them more precisely as well.
Well, in this information overload kind of state that our society lives in today, everybody wants answers to everything. Everybody wants objective data to make a specific diagnosis. Not just clinicians, but patients as well. It's nice to be able to diagnose a specific pathogen which is leading to their symptoms.
The film array instruments and the technology has changed an awful lot of the ways we're approaching infectious diseases across the board, both from a clinical perspective as well as here in the laboratory. It's been a game changer in many respects.
I've been around for a certain period of time where I can recall waiting 2, 3, 4 days for cultures and sensitivities on either respiratory or gastrointestinal cultures. And this has just been a paradigm shift with respect to how quickly we can get that data to the clinician in a meaningful and actionable way.
We get an answer within 1 hour. And so if I have a clinical suspicion of an upper respiratory symptom or a lower respiratory symptom, I order the test, I get an answer within an hour. And to me, that's the most important selling point. Another important characteristic of the test is that I get a reliable answer, whether it be a positive test or a negative test, and again, in a short period of time.
The most important qualities of the Biofire system is accuracy. Without accuracy, it really has no value for us at all. After accuracy, then the speed. We've had lots of experience of patients in the emergency room getting results back while they're still in the emergency room.
We've confined patients to the hospital, to the inpatient wards for years while we sat around and waited on test results, on culture results, or traditional testing results. I say to people, you need to trust your instincts, trust the years of clinical experience that you had, and use this new rapid diagnostic test that gives you answers within hours.
You're shortening the length of stay for patients. You're shortening the amount of time the patient spends in an intensive care unit, all of which, of course, is reducing your overall health cost.
I just love having that information at my disposal within a very short period of time of ordering it.
It allows them to find answers to the questions they're seeking when they're diagnosing their patients. This is why we're here as a lab.
As microorganisms continue to evolve, it's time for testing methods to evolve too. The Infectious Disease Society of America and the Society for Healthcare Epidemiology of America agree. Their guidelines recommend the use of rapid diagnostic tests for bloodstream infections with an effective antimicrobial stewardship program. With results like decreased mortality, reduced time to effective therapy, and shorter hospital stays, it's clear that combined with antimicrobial stewardship, rapid diagnostic testing is the most effective and efficient testing method. As the leader in rapid syndromic testing with 5 FDA-cleared syndromic panels, Biofire was the first to develop a comprehensive test for bloodstream pathogen identification. Since then, the Biofire BCID panel has been proven to reduce unnecessary antibiotics and get patients on optimal therapy faster. You can decrease time to effective therapy and prescribe the right treatment earlier, potentially saving lives, and reduce hospital costs for some patients by shortening their stay and decreasing the length of antimicrobial therapy. Once more, Biofire has evolved rapid molecular diagnostic testing to identify more pathogens than ever. Now in development, the new Biofire BCID2 panel will expand testing to 43 targets, one panel about an hour. With just one panel, identify even more of the most common causes of bloodstream infections. It will identify new anaerobic and fungal targets, possible contaminants, pathogens typically not susceptible to empiric therapy, and additional resistance genes, which includes a new assay to identify MRSA. The Biofire Blood Culture Identification Panel. Faster identification, better antimicrobial stewardship.